No, okay, we're good. Webinar is being live streamed. So, Assalamu alaikum, Bismillahirrahmanirrahim. Thank you very much. Thank you, Bilal, for joining us today on tonight's fireside chat session with Noor International University. मेरा नाम है सालिम रहमान. आज हमारे guest हैं Bilal Mumtaz from Elaj. We'll hear a little bit more about Bilal and Elaj. Just now, हम admin team से request करेंगे कि NIU की current program and admissions के बारे में थोड़ा सा बता दें in a brief promo video. So, admin team, over to the promo video, and we'll be back in a minute. Okay, G, thank you very much, admin team. Welcome back. A quick introduction करवाते हैं जी to Bilal, and then Bilal हमें Elaj के बारे में बताएंगे. Bilal Mumtaz is the co-founder and head of partnerships at Elaj. He's a graduate of the University of Western Ontario in Canada. Bilal returned to Pakistan to launch family-based startup sehat.com.pk, which I understand has merged into Elaj, which was the nation's first online pharmacy. Bilal is a Google certified professional in digital marketing and holds multiple certifications in various realms of healthcare and technology. He launched multiple verticals of Sehat, which included vaccination programs, pharmaceutical marketing initiatives, and medical equipment distribution for the online platform. Aside from this, he's affiliated with the Lahore Chamber of Commerce and Industry and Pakistan E-Commerce Consortium in the realm of e-commerce, and the Digital Health Association for Healthcare in the pursuit of pushing forward policies that help impact the digital landscape of Pakistan. Bilal is an avid football enthusiast and actively promotes football in the region of Chitral and is affiliated with the District Football Association. He is an aspiring key opinion leader in the realm of health tech and aims to improve the state of digital healthcare in Pakistan. And before going live, Bilal हमें बता रहे थे कि actually very shortly he's going to be going to Chitral to promote football. So उसके बारे में भी जरूर हम सुनेंगे. And with that, Bilal, मैं आपसे request करूँगा कि whatever blanks that we may have missed आपकी introduction में उसको भी fill in करें, but more importantly आज आप थोड़ा सा अगर हमें बताइए about what Elaj is, and of course don't forget to unmute before you start speaking. Over to you.
Thank you very much for having me on the show, Salim. It's really good that universities like yourself are taking this initiative to learn more about the startup ecosystem in Pakistan, and what better way than to actually delve deep into the mind of the founder. So for me to tell you about Elaj, I think, like you mentioned, it's very natural for me to dabble on about Sehat, because Sehat merged with another health tech company, Augment, to form Elaj. So Elaj, just off the get-go, because I want to answer your question first, is deemed as the nation's lifeline. It is termed as a health tech initiative that is well immersed in the realm of digital healthcare and providing teleconsultations with reputable doctors, primarily general practitioners. It provides e-pharmacy services, so that's delivery of medicines to your doorstep anywhere in Pakistan. It also is involved in developing clinical management software on demand, and it also is involved with working very closely with insurance companies to provide digitized OPD processing. And, you know, if you want to talk about my direct experience, so you can just scratch maybe 3 of the 4 things I said and just go straight to e-pharmacies, because that's more or less what Syed was involved in. So when I came back to Pakistan from university in 2013, our family, which constitutes a very large healthcare group in Pakistan, known as the Fazal group, immersed in many different aspects of healthcare, but most commonly associated with the pharmacy field, had been broken up into different segments. And with our family, we saw a huge decline in the original Fazaldeen and Sons pharmacy operation that one time had multiple branches over Lahore, but then was reduced to one because a lot of family members had decided to put more focus on their own novel ventures instead of focusing on the main pharmacy operation. So we decided, alongside my father at the time, who was still alive, that we wanted to delve into the field of pharmacy because that was a field we were most commonly associated with, and a field which all of not so much us, but our father was very familiar with. And we decided that that time in 2014 was the right time for us to launch and do so in the guise of an online portal, because we knew that looking at more developed countries, every member of the population was becoming more digitally inclined, and e-commerce was definitely on the ascendancy over there. We actually launched around 3 to 4 months before the mobile internet revolution in Pakistan, and when that happened, that increased our numbers quite a bit. So Sayed, like you mentioned, and not to really delve in it too much because I know that large is the topic of discussion over here, then started its own course of its own core competency, where we capitalized on the fact that we invested heavily in a warehouse where we procure medicines directly from the manufacturer and distributors. And that's something that essentially differentiates us from many of the other e-pharmacy players in the market. Then, from delivering, say, close to around 20 to 30 cities in the beginning, we decided to tap into the corporate sector. We then decided that we could do deals with, certain other very reputable pharma players in the market for other product lines, like with the home vaccination program. It actually started with Pfizer for just a singular pneumonia vaccine. And they made sure that we were only one of 3 sale points in the country for that vaccine, because they saw in parallel markets that this particular pneumonia vaccine was not being kept in its proper conditions and being sold at multiples of the price in which it's supposed to be offered. So we launched that in 3 cities, and we found that it wasn't really gaining much traction. So we then adopted that home vaccination program on our own, and we offered it for vaccines other than the pneumonia vaccine, like for flu and for typhoid. We also started getting a lot of traction over there. And then when it came to medical equipment, in the wake of the first really bad smog over here in 2017, we actually managed to procure some high quality air purifiers from Korea that use UV light technology to filter out, not just smog particles, but viruses of different sorts as well. And with pharmaceutical marketing, as you say, that naturally came into the play because the relationship you have, the manufacturers, they saw us as a very, high performing sales channel, but also as a reputable source for them to trust with procuring their medicine and selling it to the end consumer. So naturally, we started actually getting budgets from them for marketing their products on different platforms, such as our social media and on our own website, and reaching out to the right customer with different bundles and packages and promotions and whatnot. Fast forward to 2021. In 2017, as you briefly mentioned, that Augment Care was launched then. It was VC backed from the start. It was run by one brother of mine, Heather, and had some involvement from our own direct family, but was VC backed from the start, and was focused on initially Instant Doctor, which was the teleconsultations part of it, the fact that you could see a doctor instantly, hence the name. And it dabbled in clinical management software too. And in 2021, both companies were successfully merged. They raised that merged entity, which is rebranded as a large, ended up raising $1.6 million. And we're here at this current juncture right now. And because of the investment, we've been able to, lessen the delivery time from, order placement to receival of the goods at the customer's doorstep, because we invested in our own fleet. We've made some investments in our tech. We've hired a lot more people, and we're just continuing to make strides. And we're essentially getting that momentum that we've built over the past 7 years to a much greater level now that we've gotten the resources to do so. So that essentially is this type of large for you.
So अगर मैं आपसे ये पूछ सकूं बिलाल, right off the bat, आपने of course we most of us who have grown up in Pakistan, which also brings I think age, my own age into perspective here, is well familiar mashallah with Fazal Deen, जो आपका नाम है family का, again all the way from medical equipment, medical devices से लेके to pharmacy services. Let's touch upon the last 18 to 24 months, जिसमें of course हमने दो चीजें witness की हैं here in Pakistan. One of course is COVID, and COVID की वजह से there's been of course not just in Pakistan, a global healthcare pandemic. उसकी वजह से आपकी ये potential एक तो health का general profile landscape भी uplift हुआ है, and जो आपकी कुछ services हैं, for example like teleconsult services, like e-pharmacy services, people would have wanted not to have gone out that much, as well as let's say even clinical management software, which would help kind of space out clinical, let's say अगर आपने लेने हो, कोई referral लेना हो या something. So on the one hand, COVID hopefully would have impacted positively the business of Ilaj and Sehat in its past. And the second thing would be the rising tech VC play and a lot of angel investing. The whole tech landscape was obviously evolving. We know a few success stories, including yours, that benefited from this time. So walk us through कि पिछले 1.5 साल में exactly क्या हुआ आपके particular realm में, and how that has impacted or either evolved your business model or made you think about how to best extract value from where the current situation stands. Oh, you've gone on mute again. Sorry.
आपने पूछा कि कोरोना वायरस की पहली लहर से आज तक कितनी तब्दीलियात हुई है और क्या तरक्की हेल्थ केयर इंडस्ट्री ने फेस की है. तरक्की for lack of a better word, I mean lives were lost and healthcare systems were stress tested as well. So it's a very intricate question, and it's a question that essentially is built upon stereotype. Stereotype तो ये है कि लोग ये भी सोचते थे कि काश मेरी हेल्थ केयर की बिजनेस होती. I would have made a killing in COVID. But what if I told you right now that a lot of the big retail brick and mortar pharmacies that I talked to actually said that they made a year-on-year decline in sales ever since the first wave up till now. It actually didn't surprise me for me to hear that, because I saw the demand of people not really realizing how long this was going to last. Even in the first wave, actually, बहुत सारी restrictions और बहुत सारी पाबंदियां लगी हुई थी. बहुत सी दुकानों और institutions और दफातर पर. But even then, right, even let's say a grocery store was only allowed to operate till 5 p.m. A pharmacy was still allowed to operate till 9 p.m. And that was the most the pharmacy was hit. Second wave onwards, 24/7 वो declare किया गया था because it was essential services. And that, people at that time were so worried, they started getting whatever they could from a pharmacy in one go. And you found that, I think, when it really, really was stress tested in terms of the nation's healthcare systems, that in March and April and May, in that particular quarter, there was a lot of purchasing being done by the individual consumer. You could say 3 to 4 times his monthly purchasing was done in a single month. But was he recurring? It wasn't really clear, and it wasn't really that stress from there on in. Another part of healthcare that actually suffered from the first wave up till now was elective surgeries, because there are a lot of people in my family that are involved in medical equipment distribution, namely in orthopedics and in cardiology and radiology. So in this particular time, especially when it gets really bad, elective surgery is such a thing where if somebody has to get an implant put in, it's not considered as an emergency procedure. There are 3 levels of essentially elective procedures. One is required, which it literally involves like an implant being put in your knee. One is totally optional, meaning that you don't really need it. It's not like a life and death, not even life and death. It's not really a situation. And then there's something that is totally what you call selective, which goes between required and optional. Sorry, optional was the one which could, strange to dermatological procedures. They say someone wants to get a facelift, that's optional, but still an elective procedure. And then selective is say like maybe getting some procedure done that, you know, if you don't get it done, it's not like the worst thing that could happen, but some people might recommend that you do it. So that was another area that we saw a decline in. And if you talk about essentially teleconsultations and e-pharmacy services, so what we can say is that, yes, we managed to fare quite well, at least during the first wave, but there was a lot of pandemonium going on. Why was a lot of pandemonium? For one, the first treatment that people, had discovered, which is Resocin, was manufactured by this one pharma company called Bayer, and they had 300,000 tablets in the country, but they decided to export it all to China. And then it was so funny that in this particular time, even people in my own family who I, greatly respect for their insight in the industry were direly waiting on speeches from Donald Trump, out of all people, to announce the latest cure in Corona, because, the leading companies at the time that were doing all this effort were American. And he had access to information. And America was also going through a very, very bad way with around 250,000 deaths and more than 1 million people affected. And even, over there wasn't that much of an emphasis on people wearing masks. So what we can say is, yes, namely when it came to essentially guiding people, not so much folks on sales, but guiding people who were trying to make sanitizers, about how to go about doing it, how to guide them on how to get them registered and how the sales should happen. That played in our favor. And that was sort of like us saying that, if you catch if you give a man a fish, you feed him for a day, but if you teach a man how to fish, you feed him for a lifetime. And then that's something that happened over there. And then what happened was DRAP came up with a list of approved manufacturers for sanitizers. PCCR, SIR necessarily came with guidelines for doing that. So what we saw is essentially, it's not really comment on sales, but the gross merchandise value and the demand of people coming to the website and placing orders went through the roof. For the teleconsultations part of things, yes, it affected us as well. The government of Punjab, urged a lot of teleconsultation players to offer free teleconsultations. And what, my brother had actually provided me as insight was that there were a lot of people from countries like Yemen and Syria that were jumping on this. So it wasn't just, feeding a demand for people in Pakistan. It was that, we can, leverage this platform sitting from another place in the world. We don't necessarily have to be Pakistani, but if the doctor speaks English and we can understand him, we can get that, meaningful advice. And the government was also urging us that offer the maximum discount you can on essential PPE items like, gloves and masks and suits and sanitizers were applicable, of course. If they're registered, you can sell them, do it and give it at like a saving. So I hope that answers your questions about how people perceive the pandemic.
So definitely, it seems the pandemic would have probably uplifted, boosted the sort of business model that you had. Usko hopefully a boost mila hoga. What about the tech side of this? Obviously, in the last 2 years, हमने बहुत ज़्यादा एक exponential rise देखा in funding, in people getting interested कि Pakistan is finally on the scene, on the tech scene. So how much of the tech part, that buoyancy that we have seen recently in Pakistan, uska kitna impact hua hai on Ilaj? And how can you guide us on that story? How difficult has it been to sell, let's say, Pakistan, healthcare, health tech Pakistan? Uske बारे में थोड़ा सा बताइए. Oh, sorry, muted again.
Every time I click the unmute button, it automatically mutes for some reason.
ठीक.
But वो जिस तरह आपने मेरे से सवाल पूछा है, वो एक नेचुरल एक चीज है कि अगर आप किसी फाउंडर से बात कर रहे हैं तो लाजमी ये तो उनको बताना पड़ता है कि किस तरह आप फंडिंग रेज कर सकते हैं अपने स्टार्टअप के लिए, अपने वेंचर के लिए. So yes, we are currently sitting at around $300 million raised for startups in this year alone. We were, the country with the 4th highest amounts of funds raised in the MENAP region, और हमने basically सारे previous records को तोड़ दिया. For a lot of tech startups, namely, say, the airlifts that were pivoting from transport into, grocery startups, it's very funny because you see, the top level grocery startups in India actually going through decline, but they're on the ascendancy over here. And the reason they're on the ascendancy over here is because I think, despite what we might say about our own people, they're actually they were quite sensible when it came to pandemic. They were fearing for their lives, you know, at least in the first wave and second wave, people were wearing masks. There were efforts made by the government to vaccinate people. There wasn't a mass migration of people from urban centers to rural areas really, you know, happening. Everything was sort of contained. We knew from the get-go कि ये मुसाफरीन फैला रहे हैं. जो लोग बाहर से आ रहे हैं, they're bringing the virus with them into Pakistan, and we're able to contain it like that. In fact, one thing that Augmentcare was able to do, because they have investors that are, you know, largely based in Hong Kong and Singapore and have links with, you know, other big institutions of the world, that the House of Commons actually presented a report that was made by Augmentcare and Director Sparklegs about how well Pakistan handled the pandemic. Health Services Academy के डीन से मेरी एक गुफ्तगू चल रही थी 2-3 हफ्ते पहले, तो उन्होंने कहा था कि पैंडेमिक से पहले हम तो I think 120 or 130 रैंक करते थे global health systems में. After the wake of the pandemic, we were in the top 5. Wow. Based on how the NCOC actually handled everything, based on how we were vaccinating people, based on how we're spreading awareness about how bad this pandemic could have been. So, you know, I think your question covered sort of that, you know, about how the tech played a part of it. In our sense, it wasn't so much the tech, it was the fact that we had a very good narrative we were leveraging onto tech. Ultimately, dilemma to ye hota hai, right? That especially in health tech, most of the players are tech based, but they're going into healthcare, but hum opposite direction hai. हम already healthcare में घुसे हुए थे और हम tech में आना चाहते हैं. But you know, every approach has its advantages. Our advantage was the fact that we had product knowledge, we had very good links with our suppliers, and we essentially could connect with our customer coming from a retail background, like probably no other startup could during our tenure. So ये मैंने चीजें कहनी थी.
Thank you. I think thank you for sharing. Let's थोड़ा सा switch gears करते हैं बिलाल. आपका ये जो इलाज है from my understanding जो आप बता रहे हैं, इसका थोड़ा सा मैं let me ask you maybe give you a slight curveball here. इलेक्ट्रॉनिक मेडिकल रिकॉर्ड्स के बारे में थोड़ा सा बात करते हैं कि यहाँ पाकिस्तान में एक हमारा जनरल सेंटिमेंट है, जनरल ट्रेंड है कि हम एज पाकिस्तानीज परहैप्स हमारे क्योंकि स्पेशलिस्ट इतने अवेलेबल होते हैं, हमारा कोई जीपी की ओरिएंटेशन इतनी ज़्यादा नहीं है, विच मीन्स जनरली अगर आपको कोई स्किन की का इशू हो रहा है तो आप सीधा डर्मेटोलॉजिस्ट के पास भाग जाएंगे, आंख का इशू हो रहा है तो आप ऑप्थेल्मोलॉजिस्ट के पास भाग जाएंगे, एंड सो ऑन एंड सो फोर्थ. एंड एज अ रिजल्ट आपके पास आपकी अपनी ही फाइल मौजूद होगी और इन इट्स as up to date as you keep it, your printouts and so on and so forth. So my understanding would be कि अगर for example मैं आपका platform use करते हुए I sign on as Salim Rahman onto the platform, would I get access for example or through if I were to choose let's say clinicians जो आपके platform पे हैं, could I build up my online single briefcase based EMR जो कि मेरे पास available होगा like A forever and ever, and I don't have to come back, scan a page or put it in a file, number one. And number two, मेरे जहन में आती है एक चीज़ कि जी यहाँ पे फार्मेसी इंडस्ट्री भी of course आप लोग फार्मेसी भी चलाते हैं in particular, फार्मासिस्ट का टेक्निकली होना ज़रूरी है, but we know that is often flouted. वो एक लाइसेंस लेकर रख के दीवार पे लगा होता है. Which brings up the second question कि contraindications होती हैं बहुत सारी medications की, and I could imagine कि अगर अच्छा एक EMR बना हो और उसके साथ में एक fulfillment का module हो, for example for pharmacy based disbursement, तो contraindications could already, for example through AI, through machine learning and through whatever वो pharmacopoeia जो आपका होता है, that could be used to say कि ये pre-existing आपके साथ कुछ हो सकता है, are you still taking this medication? Is there something like that which is built into your module at Elaj or whatever you've inherited with regards to Sehat? उसके बारे में थोड़ा सा बताइए.
Yes, it's not muting again. So those were two questions, right? The first question, because I really focused on the second question that you asked, and it's quite a lengthy question about EMRs and about essentially what we call precision medicine, which is actually prescribing the right medicine to the right patient, and whether that can happen on a recurring level. And the first thing is about, you know, how receptive is the EMR in Pakistan. So I'd like to answer the first part of that first. So, when it comes to EMRs, I think the reason why we're not really seeing them take off the way they do is more to do with the doctor. अच्छा, डॉक्टर यहाँ पे बेसिकली बाय एंड लार्ज कैश में डील करते हैं हर पेशेंट के साथ, कैश पे डील करते हैं, पर्चियाँ मैन्युअली लिखी जाती है, and he is afraid that if anyone gets a hold of that EMR, they're able to calculate how many patients he's seeing a day and how much potential revenue is making, henceforth how much tax he owes. I mean, it's a taboo, but it happens in the market that this is a way for them, to make extra bucks, and for a large part is undocumented. But my opinion is if they're providing a service to the end customer, right? I think that what should be stressed on first is how well that service is, and then the secondary issue should be, okay, how should that business be documented? But when it comes to even the work that we're doing, we're more or less promoting a default or de facto prescription management services for our patients. We're telling them, even if you want to be in a large user, you don't necessarily just have to go to the website and place an order yourself or talk to somebody. You can WhatsApp us your prescription and we do the rest for you. So there is that level of automation that does exist. And with, say it now, Ilaj, there was a patient database that you could upload, say like you bought medicines for your entire house. मगर एक order पे आपने शायद खान सामा के लिए medicine order किया, एक order पे आपने अम्मी के लिए कुछ किया है, अबू के लिए कुछ किया है, भाई के लिए कुछ किया है, might have gotten something for yourself. That database over there exists. But then again, the thing that you sort of brought in the second question was involving three different fields of medicine. It's involving the consultation with the doctor itself. It's involving the field of pharmacy, and to a large part, it involves the field of pathology. Now, ultimately, right, there are a lot of stumbling blocks for every business model out there. You have a target market and plan. But what we oftentimes try to come to terms with is that if we try to target an offline customer and he is a recurring medicine user, it is very likely that his prescription changes every 2 or 3 months for a multitude of different reasons. Could be his environment, could be his blood work, could be his age, it could be some other condition that he's developed all of a sudden. And that's why precision medicine, you'd say, is so important. There are ultimately around 3 to 4 different types of reactions that can happen from drugs, which is either through the combination of another drug, it's a combination through the food that he has, it's a combination, it's basically can be contributed by his environment in question. It can even be contributed by something, totally external. But at the same time, right, what Augment Care was doing or Large is doing, when you go see a doctor, right, you have that option of getting a note or diagnosis made for you. There is a prescription that's already written. That prescription is yours to keep, and it can automatically be forwarded to a largest pharmacy for it to be fulfilled. They have a pathology partner as well, so you have your blood work on you at all times. And that's essentially what the future to me should look like. I mean, I can give an example of how we issue Schick notes, our own company, which have actually started being issued by the likes of very big organizations like Daewoo and Metro. It's that I feel sick one morning. I literally open Elaj's app and I book an appointment. I get a call from the app. I don't have to check again to see, okay, doctor aa gaya, nahi aa gaya. And a doctor talks to me and I tell him, okay, I've had a runny nose, I'm feeling sick, all that. And she's like, okay, I'll write you a sick note prescription. And when that sick note gets written through that interface of that doctor, it automatically gets forwarded to your HR department. So if your HR, if people are making efforts to digitize their HR, imagine how much of a godsend it is for having that sick note become digitized as well. So automatically in the system, you're automatically declared sick. And you don't have to call your HR manager again and say, oh, acha, main bukhar ho gaya, main aa nahi sakta. And then with the automation, the medicines also automatically get delivered, if that's the case. And if any blood work or any pathological report needs to happen, that can also be automated and arranged. But what you're saying, right, is, and that's the thing that I answered earlier about, how can the AI sort of come into play by examining my condition and seeing it, okay, if you have an allergy or if you're basically not feeling well, or if, like, say, a medicine is found to not be available in the market through the quick index of medical products, which is QIMP, and how can that be recommended? So ultimately, right, if the pharmacist is only legally allowed to recommend a substitute alternative to a medicine you're already taking. Otherwise, if you really want to get advice on a level that, okay, based on the fact that I've also been feeling this, what else should I take? That is left to the doctor, actually.
Fair enough.
And,
Fair enough.
and then, yeah, precision medicine has a long way to go in general over here. But this is what we're able to do, and this is how it would play out if you talk about that scenario, if that makes sense.
लेकिन आपका पॉइंट बिलाल इज वेरी वेल टेकन जो आपने कहा कि जी लेट्स से इलेक्ट्रॉनिक राउटिंग ऑफ जो आप कह सकते हैं एंड टू एंड लाइक लेट्स से इफ आई वुड टू कम ऑन एज ए पोटेंशियल पेशेंट मैंने एक कंसल्टेशन इलेक्ट्रॉनिक कंसल्टेशन की आई एम एसोसिएटेड विद लेट्स से डेवू और मेट्रो व्हाटएवर एंड सो उसका सिक नोट भी गया एंड फुलफिलमेंट भी हुई इट सेंड्स an electronic signal for dispatch of medicine and so on and so forth, and then of course it builds a record. So I think a large part with your contraindications wali baat hai that you're right KG, on one note multiple things could be done, but as long as one is using that particular platform and is generally a one-on-one which is meant to be, unfortunately again yahan pe a lot of pharmacies don't even bother looking at prescription. They'll just issue the medication and just get you to pay for it, and that's it. So okay, fair enough. Again, let's switch gears thoda sa. Payments, obviously now we're talking chale cash on delivery to ho sakti hai for medicines being delivered, somebody has to physically go there, lekin jo ye micro payments aapki ho rahi hain for consultation, online consultations वगैरह, what's been the challenge and how have you managed to alleviate that? It's definitely continues to be a pain point, kind of offline. अच्छा जी मुझे WhatsApp कर दें, मैंने पे कर दिया है, मैंने इलेक्ट्रॉनिक ट्रांसफर जैज कैश कर दिया है या सिम कर दिया है या whatever the case. आपके केस में क्या है, and has there been a true workaround or an alleviation of that pain point?
So, I mean, that pain point, to be very frank, didn't really exist with Sayed because every single payment method was catered for, including cash on delivery and the other methods. But with Augment Care, when it started out, it sort of had that trouble capturing the B2C market because it could only really offer online payments for the model that it supported, which is more or less a subscription model, to speak to a doctor online. And it operated, not as an e-commerce company, but as a SaaS company. So that also further cemented its reasoning for dealing in patients who would be paying them online. That made reconciliation and all these other, hurdles much easier to go through. But then again, the way they sort of alleviated that problem was essentially targeting a lot of different corporations and organizations and higher institutions, and then providing value, like I say, about teaching someone how to fish as opposed to giving someone a fish. That, it's not just about the fact that we're giving you the option to see a doctor. What if that doctor was responsible for getting rid of your, absenteeism in the workplace? What if he was responsible for letting, improving employee morale by letting them know that their health was taken care of to that level of precision by the organization? See, those were things that, we learned a lot through, our various learnings and various experiences. And that's essentially what we continue to do through Elaj. We continue to be the nation's lifeline. And it's an all-encompassing slogan that just doesn't, encompass the fact that, oh, मैंने आपकी organization को instant doctor consultations भेज दिया. Oh, मैंने आपको medicines एक discount पे पकड़ाया है. It means that even what the company does collectively is to help every single person out any way they can and add value in his life. That's maybe even where the football initiative comes in.
Fair enough. Great, thank you. Acha, again, switching gears, Bilal, Sehat Card, universal healthcare. I think Sehat Card की एक कोशिश है obviously पाकिस्तान में. Do you feel कि यहाँ पे कोई opportunity exist करती है for the realm that you are operating in currently or somewhere in the future? How could it plug in? And number two, it brings up, I'm sorry to keep on asking double-headed questions. Number two, इसके बारे में सोचिए, and maybe you can briefly dilate upon this कि अगर सेहत कार्ड का initiative चलना है in a country like Pakistan, जो कि हम obviously continuing to be a developing nation, affordability becomes a question mark, and therefore generics and the use of generics becomes a key consideration. So What do you think are the opportunities that exist in these two areas, if at all, for a company like Elaj?
So the first question you asked was about Sehat. Now, Sehat is a wonderful initiative that had its roots in KPK and then expanded to different provinces around the country. And now it is not only providing treatment on public healthcare institutions, it's also providing treatment through the private sector as well. So henceforth, I think the one further step that they need to take is to essentially get digital vendors on board. That means that if somebody, at least in the primary level of healthcare, wants to speak to a general practitioner, I see a lot of scope in having a digital platform where a reputable general practitioner can speak to a patient and alleviate his problem. And then, from there on in, ancillary services like pathological and pharmacy services can also come into the picture and take care of that patient's health. It would be a long way to go because this is a country that, though claims to have 100 million, digital users on mobile internet, digital literacy still has a long way to go. And the main goal of the Sehat Sahulat program is not to essentially get people to become digitized, it's to provide healthcare to them through all means possible. And I think digitization and digital literacy will be something, in the fray when it comes to actually, bringing these services and, building the ecosystem up even further. And I'm sorry, I didn't catch the other part of the question.
The second part was generics. Again, because of pharma ki orientation hai, let's say, for example, would you, for example, in your interface, be able to say, "Kya acha ji, aapke doctor ne advise kiya," which is a brand name. By the way, you have generic 1, 2, 3, 4 available, and of course, as the Sehat card deployment happens and there is, for argument's sake, a prescription based plugin available, though generics become a big part of what the government would drive, as opposed to the brand name, a fraction of the price would get you a reasonable generic. So आपका ख्याल है कि वहाँ पे generics का scope generally in let's say while dispensing medication would come into play, and is there an opportunity for someone like you who would have your finger on the pulse, right? कि क्या चीजें ज़्यादा dispense हो रही हैं? What has a scope for getting more into generics in Pakistan or getting licensed generics into the country? That could be a great data to mine and to deal with.
That's a very interesting question. In this, right, perception is more or less everything. When you talk about the total pharmaceutical supply chain in Pakistan, a third of it is tainted. When I say tainted, it means that either it's fake, it's spurious, or it's adulterated. Fake means that the concoction and the packaging and everything about it is unauthentic. Spurious means it's just not been stored or properly, therefore making it lose its efficacy. And then adulterate means that there's been some change in its structure. So essentially, right, when you talk about wholesale markets in Pakistan, from Shalmi and in Lahore to even that Fazal and Peshawar, essentially, right, these are essentially markets that sell, paracetamol tablets by the bag, by the plastic bag, and they don't really have a brand name. They're called paracetamol. So essentially, the way the industry has been running has ruined any, I think, potential for the generic market, at least on the allopathic sides of things, to take storm and to take precedence over, say, the current, market conditions at the time, which is very much brand oriented. So even if you go to a doctor, he's going to prescribe you a brand. He's not really going to prescribe you a generic, which essentially makes, the pharmaceutical industry in Pakistan quite unique. And, that essentially gives, a really, really big brand name, that recognition all around. Okay, basically, metformin name prescribed ho rahi hai, lekin getformin provided prescribed ho rahi hai in terms of the fact that it's made by Gets. And that's, I mean, that's totally fine as long as, the efficacy of that medicine is all right, and the manufacturing practices are in order, and the local drug regulatory authority is doing a good job in registering it on time, and there's no shortages that can happen based on raw materials or inflation or manufacturing defects of any sort. Usme dispensing, the second part, yes, There are a lot of dispense items that are not being manufactured right now. Interestingly enough, I had to arrange for Valium suppositories around a few months ago for a friend of mine who had another friend in Rawalpindi who needed it quite urgently. और मुझे बहुत अच्छी तरह से याद है that she needed it by the morning. When I managed to get it, by that time our warehouse had closed, so I couldn't call a courier. I actually had to go to a Daewoo and get it shipped across. And that's the lengths I'm willing to go to help a customer out. I mean, that's also a testament, that dispensing has that scope, that I was referred to that customer because I was also, or Fazal actually was also known for having an excellent compounding and dispensing unit.
Exactly.
And it was for a unique product that you couldn't really get at a pharmacy.
Fantastic, great. Chale, so I think from a pure professional standpoint, I think we've had a substantial discussion, and I hope you as well as our audience जो के सुन रहे हैं उनके लिए ये it was an interesting area of discussion. It's a new realm. I think we're touching upon of course healthcare technology, pharmaceuticals all in one. So we've got just a few minutes left. Where do you feel, based on where we stand today and based on where you stand today in particular, Elaj, as a platform, what's next? What's happening in the next what's happening the next year? What's happening next 3 years? What can we see? What can we do? We don't have a pharmacy program yet actually at NIU, but interestingly, that's one of the things that has been on our radar in the near future. आप क्या सजेस्ट करते हैं, क्या देखते हैं अपनी इंडस्ट्री में क्या हो रहा है, आपकी पर्टिकुलर कंपनी में क्या हो रहा है, एंड वेयर डू यू फील कि somebody like a university like Noor International can plug in?
अब हम इस स्टेज में खड़े हैं जिसमें हर फार्मेसी ग्रेजुएट के पास डॉक्टर की डिग्री आती है. It's called a doctor pharmacy right now. I think a doctor physical therapy also exists in Pakistan. And right now, like, I mean, I don't want to directly quote your competitor's name. I mean, it's another university that I think has done, leaps and bounds in promoting entrepreneurship. In fact, pharmacy is one of the particular majors where you need to actually do another certification in entrepreneurship in order to graduate. And that's fueling a lot of minds, to think very progressively, to think about actually solutions that impact the nation as opposed to just solutions that make the money. Because what does a pharmacy degree entitle you to? It just entitles you to either get a category A or category B. And it lets you have that opportunity of working in a pharmacy or another organization that would require your services. Or pharmaceutical industry in general, and where I see it, maybe a year from now, I see a lot more e-pharma players coming into the market. In a few years from now, what we should see is, inshallah, the sooner the telemedicine policy for the entire nation is passed, which actually I'm currently spearheading through the Legal Health Association. I serve as a Secretary General over there. The more we see, all realms of healthcare, namely pharmacy, actually being, properly stress tested, properly verified, and impacting changes on levels that we could not even imagine before. Or pharmaceutical tracing was something that has been happening over the past few years. A lot of startups in that, did back up shop and have moved into analytics since then. But that is also something I think it's very important, knowing actually the supply chain of a drug from when it's manufactured to when it actually goes to the end consumer. I see us making strides over there. And most importantly, I think Pakistan should see an FDA-approved plant, at least one, in the next couple of years, for us to actually go anywhere before any sort of progress can be discussed in the realm of pharmaceuticals over here.
Fantastic. Thank you, Bilal. I think well answered in terms of the question. And of course, lastly, you must tell us, एक minute रह गया हमारे पास. Tell us about your love for football and Chitral. It'll add up nicely for helping us understand. देखें, हर किसी की कहानी होती है. You are sitting in front of us today as Bilal Mumtaz, and there's a personal side of Bilal which has been a part of him. उसके बारे में बताइए, quick passion, because passion is important for anybody. So
I hope to wrap this up in a minute. The first time I ever went to Chitral was in 2011 because my father, who was an HSonian, his former teacher was an Englishman who had served in the army, Jeffrey Langlands, was the principal of a school over there that he actually helped build from the ground up. It was only offering classes to grade 6. He ended up making sure it started offering classes up to FSC, and before it only inducted boys, then inducted girls. I went to go meet him, and my love for, the pursuit of seeing the mountains with my love of football made me want to hold camps over there because I knew it would just be very beautiful. So fast forward to 2021, I've already held 4 camps/tournaments over there. And now I'm doing it in honor of my father. And there is a football stadium that the District Football Association is going to build. And as part of that association, I'm hoping to bring it to a much greater level and to make people realize that we have a lot of talent in this country. And football in Chitral is just one example of a hotspot that can be capitalized on.
So fantastic. और आपने mention किया चित्राल, मेरी पहली visit हुई थी चित्राल just I think 4 or 5 weeks ago. And वाकई मैंने बहुत लोगों को मैदान में फुटबॉल खेलते हुए देखा. And it was apparently it doesn't rain too often, लेकिन we got rain and the sun came out and I saw बच्चे playing a lot of football in relatively flatland fields. So it's a fantastic story and amazing to see कि आप, it's like a CSR initiative जो आपने pick up किया है, and I hope कि इंशाल्लाह आपको इसमें भी success मिले. And of course इलाज के अंदर it's a great service जो कि आप मुल्क के लिए कर रहे हैं. Or of course it promotes innovation, it promotes entrepreneurship, and hopefully at some point Noor International now can offer opportunities to its students to come and potentially work with you, consult with you, for you to come on campus sometime soon and mentor students. So just tell them about your story, because success stories dekhte hain, these are what students are looking for, opportunities which have been executed upon well, and of course which are still in the making as well. तो उस लिहाज से हम आपका शुक्रिया अदा करेंगे कि आपने हमारे साथ ये टाइम गुजारा. It's been knowledgeable for me, always interesting नई इंडस्ट्री को देखना, एक जो कि हमारे से बहुत closely affiliated भी है उसको देखना, and of course some innovation in it as well. So thank you again for sharing with us your story with such candor. Or inshallah, we hope that somewhere down the line, as we now turn the corner around COVID, हम आपको campus पे भी welcome करेंगे for an in-person session, inshallah.
I'm looking forward to it. Thank you very much for having me on this segment.
Lovely. Thank you so much. All the best.
Okay. Allah Hafiz.